Jennifer, thanks for being with us. Now, a lot of people might be like, what is epilepsy? I know that involves seizures. Can you explain a little bit about what is epilepsy?
Sure. Epilepsy is a neurologic condition that causes brain dysfunction and seizures. Seizures can really vary. They can be as simple as a staring spell, or more like a petite mal seizure, or a more generalized tonic-clonic seizure, where they lose consciousness, have incontinence, or a grand mal seizure. Interestingly, about 1 in 100 people will experience a single seizure. That does not mean that they have epilepsy. To have epilepsy, you have to have at least 2 or more unprovoked seizures. And children that have epilepsy typically present with the same type of seizure over and over again. About 50% of cases we don't really fully understand, but we know that there are certain things like trauma, perinatal injury, infection, or other disorders that can affect the brain, such as tumors or strokes, can cause seizures.
Well, I would imagine because of seizures, and they can be kind of scary for everybody, it's important to talk about it, I would think.
Yes, absolutely. Seizures affect the child on a whole. It can have impact on their self-esteem, personal growth, academic performance. So it's really important to address those questions. Not only does addressing those questions help them maintain a normal, healthy lifestyle, but it also gives some reassurance to teachers, coaches, and their peers.
Because, I mean, like we talked about it a little earlier, it's not just the child who's impacted by the epilepsy. It really impacts everyone around them.
Absolutely. So not only do we, give the diagnosis of epilepsy, but we also find that there's a lot of other things that come along with it. Quite a bit of anxiety, or maybe even depression that we can see.
Right now.
And the child is really worried about what happens if I have another seizure. What if it's at school?
Great.
What do I do? How do I tell my friends? So addressing all of those questions can be very helpful for them to go on and lead a very normal life. We do encourage that. We like our families to work together to include nice compliance of medication, good sleep routines, and continuing exercise programs.
And if you, off the topic here a little bit, but if you do see someone having an epileptic seizure, what should you do?
You should put them on their side, nothing in their mouth, and contact EMS if it's greater than 5 minutes.
All right, but definitely talk about epilepsy, especially because it does involve everyone. So,
Yes, ma'am.
all right, thank you so much for being with us.
Thank you.
And we'll be back with more.